Good day, dear students. Now we start our lecture about retention and relapse in orthodontics. Firstly, we must know what is retention and relapse. Retention is holding of the teeth in an ideal aesthetic and functional position at the end of orthodontic treatment. This means that the teeth should be at the end of the orthodontic treatment in correct, functional, and aesthetic position. While relapse is the return following correction of the features of the original malocclusion, which means that any change from the final tooth position at the end of the treatment towards the original malocclusion. يعني أي تغير يصير عندي بالtooth position towards the original malocclusion هذا راح أعتبره relapse. Retention phase is very important in orthodontics. Why? To get successful orthodontic treatment and long-term result, the type of retainer should be concerned in the beginning of the treatment. يعني أنا بداية التريتمنت بلان مالتي لازم أحدد التايب of retainer اللي أحتاجه للكيس للحالة. In the next slide راح ناخذ different types of retainers كل واحد والindication مالته. اوكي فلازم أنا بالبداية of the treatment لازم أحدد نوع الريتينر اللي أحتاجه. كذلك استخدام الريتينر the withdrawal of retainer should be gradually not abruptly يعني بشكل تدريجي يبدي انسحاب الريتينر ونزوعه مو يكون فجائي. Why? To get more control on tooth position and to get less relapse حتى نقلل الريلابس ونحصل more control on the position of the teeth. Why retention is necessary? The success of orthodontic treatment does not depend only on the time when we end the orthodontic treatment and get good orthodontic result and the appliance is removed from the patient's mouth, but it depends on large degree on retention phase after removal of the appliance from the patient's mouth. عادة بنهاية الأورثودونتيك treatment لما نحصل good orthodontic result and the appliance is removed ما نعتبرها successful orthodontic treatment. Successful and perfect orthodontic treatment تعتمد بشكل كبير على retention phase اللي يكون بعد الأورثودونتيك treatment after removal of the appliance from the patient's mouth. ولهذا the retention phase should get more attention and respect. Why? To prevent or decrease the relapse اللي يكون after الأورثودونتيك treatment. ليش يصير عندنا relapse؟ وشنو أسباب الريلابس؟ راح نتعرف على etiology of relapse. The exact etiology of relapse is difficult to identify, but there are main 4 etiological factors of relapse include gingival and periodontal factors, growth, soft tissue factors, and occlusal factors. The gingival and periodontal tissue fibers that affected by the orthodontic tooth movement. احنا عرفنا سابقا during orthodontic tooth movement الgingival fibers والperiodontal ligament fibers راح يصير بيها remodeling ولذلك they are require time for reorganization. بعدها ما صاير بيها complete reorganization فتحتاج time for complete reorganization ولهذا هي تعتبر سبب من أسباب الريلابس قد تؤدي إلى حدوث change بالtooth position and the relapse will be occur لأن ما صاير بيها complete reorganization. الother factor اللي هي soft tissue factors and the occlusal factors. The teeth at the end of orthodontic treatment and the appliance is removed from the patient's mouth are in unstable position. بعدها ما ماخذة استقرار وثباتية كاملة ولذلك قد تتأثر بالpressures or الforces اللي تجي من الsoft tissue. قد تكون اللبس التونج التشيك، أيضا من البريشرز اللي تجي من المستيكيشن الأكلوزال فاكتورز اللي نقصد بيها، ولذلك تكون سبب من أسباب الريلابس وتؤدي إلى حدوث change in the position of the teeth. الجروث changes أيضا جدا مهمة. الجروث البيشنت قد يكون under growth and the growth changes may cause changes in the teeth position and alter the orthodontic treatment result. سبب لي أيضا تغيرات وتعتبر سبب من أسباب الريلابس. ولذلك لما أسأل أو يكون السؤال why retention is necessary or what are the etiological factor of relapse راح يكون الإجابة نفسها اللي هي gingival periodontal factors, occlusal factors, soft tissue factors and growth. نفس الإجابة راح تكون لأن شيء مرتبط بشيء. Now we take the gingival and periodontal factors. As we know, during orthodontic tooth movement, the surrounding alveolar bone, periodontal ligament fibers, and also the gingival fibers undergo remodeling. These tissues require time for complete reorganization and remodeling. Addition, the alveolar bone takes about 1 month, while collagen fibers take about 4 to 6 months, while elastic fibers اللي يكون تأثيرها أكبر بالريلابس لأن تحتاج أكثر وقت تقريبا more than 8 months to remodel. So that the teeth in this situation are unstable because the effect of these fibers try to pull the tooth back to its original position and there will be relapse. In certain cases we do alternative technique. This technique is called precision. We do cutting of the dentogingival fibers and the interdental fibers by a blade to cause healing and remodeling of these tissue periodontal ligament fibers at the new position of the tooth to get more retention and decrease the relapse. عادة نستخدم هاي التقنية in the rotated teeth حتى نقلل الريلابس اللي يكون سببه الجنجيفال and periodontal ligament fibers. Occlusal factors. It is preferable at the end of orthodontic treatment we should get good intercuspation and interdigitation between the teeth to get more stability of the treatment, more retention and decrease the relapse. In certain cases, after correction of deep overbite, as we take that previously in the previous lecture of class 2 diphthong occlusion, when there is deep overbite, it is necessary to correct the interincisal angle and get good interincisal angle about 125 to 135. Why? To create good occlusal stop and prevent eruption of the lower incisors and prevent relapse of the deep bite. Also, it is suggested to get more stability after correction of the bite. The lower incisal edge of the lower incisor should be 0 or 2 millimeter anterior to the centroid point. This point is called centroid, represent the midpoint of the root axis of the upper incisors. When the lower incisal edge about 0 or 2 millimeter anterior to this point, we get more stability to prevent relapse of the deep overbite. In few occasions, بعض حالات قليلة, there is no need for retainer, such as in correction of anterior crossbite. When the anterior crossbite is corrected, there is no need for retainer because the overbite اللي حصلنا عليه is maintained the result by itself. يعني الأوفربايت اللي نحصله هو act as a retainer راح يمنعنا relapse of the anterior crossbite. Soft tissues. It is necessary at the end of orthodontic treatment the teeth should be positioned in equilibrium area that is called neutral zone. In neutral zone, it means it is area of balance between pressures from outside that including cheek buccally and lips labially and pressures from the inner side from the tongue lingually. so that the teeth should be in the neutral zone to get more stability, more retention, and decrease the relapse. To explain that more effectively, such as in cases when we correct the overjet, as in class 2 div 1 malocclusion, when the upper incisors are proclined, so that the upper incisors should be retracted, in which fall under the control of the lower lip to prevent the lower lip from acting behind the upper incisors and causes proclination of them and resulting in relapse, so that the upper incisors should be retracted to be fall under the control of the lower lip to be in neutral zone between tongue pressure and lip pressure. Also, this can be explained in the lower labial segment should be not proclined or retroclined more excessively. If the lower labial segment proclined more excessively, we will expect more relapse due to lip pressure. If they are retroclined more excessively, we will expect more relapse due to tongue pressure. So they should be positioned in the neutral zone between lip pressure and tongue pressure. Also, the arch form is very important. If the arch form is markedly changed during orthodontic treatment, there will be more relapse. So the arch form should be maintained as possible during orthodontic treatment to get more retention, more stability, and decrease the relapse. Growth. As we know, the majority of the growth complete with the end of puberty, but there are minimal age changes that occur throughout the life. These changes include relative changes in the position of maxilla and mandible. So there will be changes in the pressure from the soft tissues. We can conclude that if there is changes in the pressure from the soft tissues due to changes in the relative position of maxilla and mandible, so there will be chance of relapse. We can explain the effect of growth changes on orthodontic treatments, such as in the cases of late lower incisor crowding. Due to growth pattern of the mandible with age, the pressure of the lower lip on the lower labial segment will be increased, that resulting in late lower incisor crowding. اكو theories نظريات تقول انه تأثير البوشنج effect from الwisdom teeth، واكو theories تقول لا الgrowth pattern of the mandible with age نتيجة هاي الجروث changes راح يزداد البريشر from اللور ليب على اللور labial segment، وبالتالي يسبب لي lower incisor crowding، وهي هاي النظرية المور acceptable من نظرية الwisdom tooth. What is retainer and why it is used? Retainer, it is a passive orthodontic appliance that used to help in maintaining and stabilizing the position of the teeth long enough to allow complete reorganization and remodeling of the supporting structures after the active phase of orthodontic treatment. Now we take the types of retainers. There are two main types of retainers that most commonly used: removable retainer and fixed retainer. Removable retainer types include Howley retainer, warp-around clip retainer, and vacuum-formed retainer, while fixed retainer types include multi-strand retainer, rigid canine-to-canine retainer, and reinforced fibers. In the next slides, we will take each one in details. Firstly, we take removable retainer. The advantages of this retainer include easier for oral hygiene, because this type of retainer can be removed and inserted by the patient in his or her mouth, so that the teeth can be brushed and cleaned easily, and also the appliance can be cleaned so that the oral hygiene can be maintained easier. The other advantage, capable of being worn part-time if required. This means that the patient can wear or remove the appliance in certain situations. For example مثلا عند appointment أو عند meeting يقدر البيشنت remove the appliance from his or her mouth، وبعدين after ending of this situation وبعدها يقدر return the appliance to his or her mouth. هذا اللي نقصد به worn part-time. The other advantage, it is responsibility of the patient, not the orthodontist. This type of retainer يعتمد على patient's cooperation لأن هو patient responsibility, not the orthodontist. There are different types of removable retainers. The first one is Hawley retainer. Hawley retainer هو عبارة عن simple removable appliance that consists of acrylic base plate with Hawley arch and Adams clasps on molars. These are the main components of Hawley retainer: Hawley arch, Adams clasp on molars, and acrylic base plate. In certain cases, we can add certain modifications or additions to the Hawley retainer ويعتمد على الكيس. These modifications include acrylic facing can be added to the labial bow of the Hawley retainer to control rotations, such as in cases when there is rotated teeth. As we see in this figure, this is the acrylic facing that is added to the labial bow. The other modification, reverse U-loop, can be added to the Hawley retainer to control the canine position, such as in the cases when there is defect or problem in the canine position. So we add reverse U-loop to get more control on the canine position. The other modification, the Hawley arch can be extended and soldered to the bridge of the Adams clasp. بدل ما ننهي الهولي arch cross الاكلوزال surface، لا نمده after اليو loop الهولي arch extended, then it is soldered to the bridge of the Adams clasp. Why? To decrease the wires that cross الاكلوزال surface, so we decrease the occlusal interference. Also, there is other modification. A passive bite plane can be added to the Hawley retainer in cases of deep bite to maintain the correction of the deep bite. حالات deep bite نقدر نضيف passive bite plane to the Hawley retainer. The other type of removable retainers is warp around retainer. هو عبارة عن wire framework that's surrounding all the erupted teeth labially and lingually, and this wire is embedded in acrylic strip. As we see in this figure, this is warp around retainer that's surrounding all teeth labially and lingually. Usually, this retainer is used in stabilizing the periodontally weak teeth. There is a modification of warp around retainer that is called clip retainer. Clip retainer is the same as of warp around retainer, but it's included just the interior segment of teeth, incisors and canines, whether upper anterior segment or lower anterior segment. Also هو عبارة عن wire framework that surround the interior teeth labially, then cross between the fore and the canine, and then surround the lingual surface of the anterior teeth. Also, this wire is embedded in acrylic strip. The clip retainer is most commonly used on the lower labial segment. The other type of removable retainers is vacuum-formed retainer. This type of retainer, as we see in this figure, is made from thin, transparent thermoplastic material. So it provides more aesthetic appearance and it is unnoticed. This type of retainer has several advantages over the other types of retainer, removable retainer, and it is most commonly used and most preferable by the patient. The advantages are superior aesthetics because, as we say before, it's made from thin transparent material, so it provides more aesthetic appearance and it is unnoticed. Less interference with the speech. This type of retainer covers all the clinical crowns of the teeth with a small part of the gingiva, so it causes less speech interference. Also, it is more economical, less expensive, and ease of fabrication. The machine that used to fabricate vacuum retainer is called BioStar machine. Also, there is superior retention of the lower incisors because this type of retainer covers all the clinical crowns with a small part of gingiva, so provide more retention and control on the lower incisor teeth. عادة هذا النوع من الريتينر أغلب البيشنتس يفضلوه and it is most commonly used than the other types of removable retainers. We take removable retainers that include Hawley retainer, warp around clip retainer, and vacuum retainer. Now we take fixed retainer. The advantages of this retainer include the patients don't need to remember to wear them because this type of retainer is fixed and bonded inside the patient's mouth. The other advantage, they are useful when the result is very unstable, so usually fixed retainer is indicated in the cases when the relapse is high. Fixed retainer is usually recommended in the following occasions: spaced dentition, in cases when there is spaces between the teeth, such as in midline diastema, so fixed retainer is indicated. Severely rotated teeth, we need fixed retainer to maintain the position of severely rotated teeth. Also, in the cases where the periodontal support is low, so we expect that the relapse will be high, so in such cases we need fixed retainer. Also, in cases when we need maintenance of the lower incisor position during late growth, to get more control on the lower incisor position due to late lower incisor crowding that occur due to growth changes, and we take that previously in the previous slide. قلنا حتى نحصل على more control على lower incisor position نحتاج fixed retainer حتى نتجنب late lower incisor crowding اللي يحدث نتيجة growth changes. Also, maintenance of pontic or implant space. لمن حالات أحتاج maintain space for implant or pontic and also keep the extraction spaces closed. حالات during orthodontic treatment, extraction treatment, to maintain the extraction space is closed, we need fixed retainer. These are the main indications of fixed retainer. There are different types of fixed retainers. The first type is multi-strand retainer. This type of retainer هو عبارة عن stainless steel wires، قد تكون 3 wires أو 6 wires أو أكثر that consolidate with each other، تكون عبارة على شكل ضفيرة. These wires, stainless steel wires, consolidate with each other. تكون highly flexible, so it can be easily adapted to the palatal or the lingual aspect of the upper or lower anterior segment teeth. Firstly, we do good adaptation of the multi-strand wire on the palatal aspect of the teeth. Then after that, we do acid etching of the palatal aspect of each tooth. After washing with water and dryness, we do bond application then curing, and after that we put the wire and adapted it well to the palatal aspect of the teeth and put a small amount of composite on each tooth over the wire, then curing. The multi-strand retainer can be used from canine to canine, whether in the upper or lower anterior segment, or can be used, such as in this figure, from 5 to 5 in cases of extraction orthodontic treatment to maintain the extraction space is closed. بحالات لما يكون عندي extraction نمده لل5، إذا كان عندي extraction لل4 أمد المالتي ستراند ريتينر لل5 to keep the extraction space is closed. Also is indicated in the midline diastema. In certain cases we can do small U-loop as a modification to get, بالإضافة للchemical retention we get mechanical retention. هذا أيضا نوع من أنواع المالتي ستراند retainer. Also we can use high gauge stainless steel wire, يكون thick wire, to keep space for pontic or implant. Or we can do certain modifications of the stainless steel wire, small U-loops, or it is called zigzag shape, to make the maintenance of the oral hygiene is easier, so that teeth brushing and flossing of the teeth will be easier as compared with the other type of the multi-strand retainer. هنا راح يكون oral hygiene maintenance is easier. All these types of retainers are considered multi-strand retainers. The other type of fixed retainer is rigid canine to canine retainer. This type of retainer عبارة عن rigid stainless steel wire, يكون thick and rigid wire that is bonded only to the canines, while the other teeth are not bonded. This type of retainer can be fabricated in the laboratory or it can be ready-made. يا إما نسويه بالمختبر أو يكون جاهز وإحنا فقط نسوي له bonding على الcanines teeth only. Reinforced fibers. This is type of fixed retainer that consists from مجموعة من البلاستيك fibers that consolidate with each other to form a plastic strip. هذا البلاستيك strip يتكون مجموعة من reinforced fibers بأشكال مختلفة يجي. This type of retainer is also bonded to the palatal or the lingual aspect of the anterior teeth. The principle of the reinforced fiber retainer is the same that of multi-strand retainer. الفرق شنو؟ بالمالتي-strand retainer يتكون من مجموعة من stainless steel wires اللي تكون highly flexible and consolidate with each other بكولات لي ضفيرة من الستينلس ستيل. لكن هنا عندي بالreinforced fibers retainers هو عبارة عن مجموعة من البلاستيك fibers اللي مضفورة مع بعضها ومكونت لي بلاستيك strip. Both of them bonded to the palatal or lingual aspect of the anterior teeth is the same principles. We reach to the timing of retention. After removal of the orthodontic appliance from the patient's mouth, the patient should be informed how to wear and remove the retainer from the patient's mouth. The patient should wear the removable retainer for the first 4 or 6 months full time, which means that 24 hours just to remove the retainer during eating, and part-time wear during sleeping at night for at least 12 months. يعني المراجع لازم يستخدم الريموفابل ريتينر أول 4 إلى 6 أشهر 24 ساعة فقط أثناء الأكل ينزعه، بينما بعدها يكون يلبسها فقط أثناء النوم بالليل لمدة 1 سنة. هذا فيما يخص recommendation of the removable retainer. بينما الفixed retainer, as we know, it is fixed and bonded inside the patient's mouth. The important property of the fixed retainer, it should be flexible enough. Why? To allow individual displacement of the teeth during mastication. مثل ما نعرف إنه teeth during eating or mastication there is some movement of the teeth within the periodontal ligament space. لذلك يفضل إنه الفيكس retainer يكون flexible to allow this displacement ما يكون highly rigid. Also, if the patient undergrowth, it is preferable that the part-time wear continue until completion of growth. يعني إذا كان المراجع لا زال undergrowth يفضل يستخدم الريتينر part-time wear يعني فقط أثناء النوم بالليل until completion of growth. عادة إحنا نعرف ال completion of growth يكون at 18 years of age. لذلك اللي أعمارهم أقل ال 18 years عادة يفضل يستمرون باستخدام الريتينر until completion of growth. Adjunctive techniques used to reduce relapse. These are soft tissue or hard tissue procedures that used in addition to the retainers to increase the retention and to get more stability. The first technique is precision, or it is called circumferential supracrustal fibrotomy. We take some information about this technique in the previous slide. Now we will take more details about this technique. This technique is performed under local anesthesia. We do cutting of the dentogingival and interdental fibers by blade. The cutting are made vertically in the periodontal pocket. Care should be taken not to touch the alveolar bone and serving the supracrustal fibers. Why we do cutting to the dentogingival and the interdental fibers? Because the elastic property of these fibers have tendency to pull the tooth back to its original position. Most commonly this technique is indicated with the rotated teeth to increase the retention and decrease the relapse. This technique شافوها تقلل relapse about 30% and should be performed with healthy periodontal tissue. There is no evidence of inflammation or any periodontal disease. Also this technique not require periodontal dressing. ما تحتاج periodontal dressing. The other technique is interdental stripping, or it is called reproximation. In this technique, we remove a small amount of enamel from the mesial and the distal aspect of the tooth so that we do flattening of the interdental contact area to get a small amount of space for realignment of the teeth. It was shown that this technique enhances the stability and decreases the relapse. Why? In certain shapes of teeth, the interdental contact area is a point contact area, so the support between the teeth will be decreased so that the relapse is more. While in this technique we do flattening of the interdental contact area to increase the support between the teeth so that the stability and retention is increased and the relapse will be decreased. عادة we remove enamel from each tooth about 0.5 millimeter on each side 1/4 millimeter. يعني كل tooth نشيل الانامل تقريبا 0.5 مليمتر بكل سايد 1/4 مليمتر. الستريبينج يا اما نستخدم الابريسيف ستريب وهذا اما يكون one side or double side. one side this removes enamel only from one side. double sided لا removes enamel from both sided. or نستخدم الستريبينج ديسك هذا يكون يعني شوية high speed to remove the enamel. either يكون أيضا أما one side or double sided. Usually after removal of the enamel, the tooth should be treated with topical fluoride to decrease the post-operative sensitivity of the teeth. Finally, we reach to the end of our lecture. Thank you for listening.